In this back pain exercise series, we're going to be covering a little over 15 exercises and stretches to get your spine stable and relieve your back pain. Now, two of the most common exercises that I see physical therapists give patients, and I love giving my patients, is building spinal stability, so getting a corset, and then doing an opposite arm and leg lift on your hands and knees. Now, the biggest complaint that I have with these patients that come in is they're often doing these exercises incorrectly. So they're great exercises, but if no one is looking at you and giving you specific instructions, all right, you need to do them right. All right, so just doing an exercise reinforces all of your bad habits, okay? Only perfect practice makes perfect, all right? So let's get your core firing and stable and protect your back. First thing we're gonna do is lie on your back, all right? So I'm gonna have you lie down, and then I want you to find neutral for your spine for me, okay? So I'm gonna have you tilt your pelvis down so you flatten your back. Then I'm gonna have you arch your pelvis up, all right? So you can see how I put a lot of space through here, okay? So this is too much of an anterior tilt, and this is too much of a posterior tilt, all right? So I'm gonna have you find that neutral point where you have a tiny bit of space, but your paraspinals, the muscles that run up and down your spine, are nice and relaxed, okay? I don't want you holding those tense. So stick your hand back there and feel the muscles on either side of your spine and make sure they're relaxed. If you need a small pillow or towel roll underneath your head to support your neck, grab that. We're not interested in torture here. We want to get you stronger. All right, so I want you to find that nice neutral position. And then from there, I'm gonna have you think about not letting someone stick their hands into your core. All right, so basically we're gonna be bracing. All right, so if you push and you're like, Sarah, it's so squishy, I can't tighten anything, I can't brace, then I'm gonna ask you to cough, okay? So if you go, then that naturally tightens your corset and makes those abdominal muscles fire. All right, so give me that nice natural corset, okay? And then I want you to work on being able to hold that while relaxing your shoulders back. No neck tension whatsoever. So I've got a nice corset here. If somebody were going to punch me in the stomach, it'd be nice and hard, okay? I equate this to my 2-year-old trying to climb on top of me. You know how elbows and knees everywhere, and so you brace to try not to let them go into your abdominal wall, all right? That's exactly what I'm looking for, all right? So a nice tight brace, shoulders and neck relaxed, hips and legs relaxed. You shouldn't have to tighten everything to tighten your stomach. Okay, I'm gonna say that one more time. You shouldn't have to tighten everything to tighten your stomach. So think about how weak your core is if when you go to tighten your core, you also have to tense and tighten your neck, all right? That's not gonna carry over to real life, and that's not gonna protect your back, right? It's just gonna make your neck tight, all right? So neck nice and relaxed, tighten your corset, relax your hips, and I'm gonna have you hold your hands in. And then I want you to relax one leg all the way out to the side. Good, and all the way back in without letting any of the pressure up underneath your hand. So what you're probably gonna feel as you bring that leg out and back in is you're gonna feel the opposite side of your core let go. Maybe it's when you get to the bottom, maybe it's when you come back up, but your core is gonna say, we don't need to help you. Now, think about it as you move through daily life. You absolutely have to be able to hold your core tight while you walk upstairs, while you move, while you stand, while you move your hips. Your hips need to be independent of your core, all right? So go ahead and work on giving me this, just a little bit of core tightness. If you need to cough, remember it's just like a ha breathing. So then that makes everything tight. Then relax your neck and shoulders, relax your hips, all right? So try the other leg, relax it out and back in without losing any tension in your core. Now, this is not a death grip, okay? You are not holding your core as tight as you can where you can't breathe, okay? This is simply providing a little bit of core stability to help support your spine, okay? So when you can do that, I want you to be able to hold and relax your neck, be able to hold and relax your hips. Now, I've seen patients get this immediately, and then I've seen patients where it's taken a couple weeks of work because their core has gotten so weak before they can master this exercise. So don't feel bad if it's taking you a while to get it, all right? You might just need a little more practice. And then shoot me an email if you need some more help. That's what I'm here for, All right, I'd be happy to help at any point in time. Okay, so once you master that, the next level that I want you to do is a leg lift. Okay, so I'm gonna have you place your hands right on your hip bones. Okay, so the front of your hips. This is called your ASIS. This is your pelvis. All right, now if you can imagine, you have your pelvis and your leg sits in your pelvis, right? So every time you move your leg, your whole pelvis should move. All right, because your spine comes down and sits in your pelvis. So what we want is a nice stable pelvis that allows our hips to move, that allows us to walk. So imagine that skeleton with that pelvis and you got that walking leg that holds nice and still for our spine to sit in. All right, so I'm gonna have you hold here, give me that nice abdominal brace, all right, where things are nice and tight, all right, but no tension in your neck, so I'm comfortably talking, I'm not holding my breath, and then you're gonna lift a leg, and you're gonna set it back down, and then you're gonna lift another leg and set it back down. And I do not want to see these pelvic bones move a millimeter. Okay, so I'm fully weighting my foot when I bring it back down. Pick up the other one, fully weight it when you bring it back down. Nothing moves a millimeter. Now, if you're weak, what's going to happen? Do you see that shift through my pelvis? Good. Do you see how I'm shifting? Okay, so hold those pelvic bones. They should not move. Okay, that's your pelvis sitting in your leg, and you should be able to have full support, all right, of your core holding your pelvis still while you move your leg in the socket. All right, give that one a shot. Now that you've mastered an abdominal brace and you've learned how to hold tension in your core, I want you to practice it not just lying on the ground, but sitting, standing. This is what I want you to use to pick up a box. All right, to lift something heavy, you're gonna brace, hinge from the hips, pick it up. All right, we're gonna have a whole lesson on how to pick things up, so don't worry. I'm gonna go over everything to save your back, okay? But the next exercise I wanna move on to is using that abdominal brace and then adding a little bit extra to make it harder. Now, this is one of the most popular exercises in physical therapy because it works. But once again, my biggest complaint is I see patients, usually after they've been to 3 or 4 other healthcare practitioners, and they're still executing the exercise incorrectly. So if you've done, it's called a bird dog or hands and knees, opposite arm and leg lift. If you've done this before and you're like, oh, Sarah, I've done that, it didn't help me, then you're probably doing it wrong, all right? So let's go over all the correct things to think about and all the tips to make sure your body is moving correctly. All right, so hands and knees, okay? I'm gonna have you spread out your fingers. All right, and you're gonna shift over your hands. Now, this is important because I don't want you engaging your neck and shoulders to execute this exercise. So if people are back, they tend to push. Do you see how I just tightened everything in here? So I don't want you pushing back with your head and neck and shoulders. So you're gonna shift a little bit over your fingertips, and you're gonna kind of seat your scapula down in your back. All right, so we're gonna talk a lot about the lats and the thoracolumbar fascia in another lesson. But for now, just know that we need your shoulders away from your ears, okay? So space between your shoulders and your ears, all right? If you're here, you're hurting yourself, okay? So space between your shoulders and your ears. Just go ahead and tuck your toes under, legs directly underneath your hips, all right? Chin tucked, head up in line with your body, all right? The first big mistake I see is people will look up when they do this. So do you see how I'm hyper-extending my neck? All right, having hyperextension in your neck for this exercise is very, very bad. All right, so tuck your chin, look straight down. You should be looking right between your fingertips, all right? Now, remember how we talked about spinal neutral, where you're not overarched and you're not rounded up? All right, so in this exercise, it's important to find spinal neutral because we're trying to teach your spine how to hold still and protect your back. Okay, we don't want to teach it to round because that herniates disc, and we don't want to teach it to overarch because that cramps facets together and causes impingement and osteoarthritis and all those things. All right, so what we want to do is find that nice neutral position, okay? Then you're going to simply give me your abdominal brace, okay? So remember that nice tightness? So you're going to hold in this position. Now I see a lot of people say, oh, I need to tighten my stomach, and they round. This is coming from a history of lots of forward flexion abdominal exercises. Do you see how this hunches me forward? I don't want hunched over posture. I want great posture that can support me to pick up heavy things. All right, so hold that abdominal brace, and then what I'm gonna have you do is just start by lifting a hand. Okay, now, what I would like to see is absolutely no shifting, okay? So what I see a lot of times is people will shift, okay? Did you see how I just shifted my hip? All right, so they will shift to lift an arm, all right? I want you to put the force in your core. So they'll either shift backwards, like this. I can almost do this without even tightening my stomach, okay? So stay forward over those fingers and lift an arm, okay? Then I want you to work on just being able to lift a leg, right? And just lift it a little. You are more focused on not moving when you lift, not letting any shift happen, than you are lifting high at this point, okay? I want you to pretend like you have a full cup of water on your back, all right? So pretend you can see that cup of water on my back. All right, now I go to lift, I'm not spilling a single drop of water, all right? But if I were to do a shift when I lifted my leg, that water would be spilled all over the floor. So I recommend you videotape yourself while you do this so you can actually see if you're moving, because patients in the office, they can't tell they're moving. So I'll come stand right beside their hip and then ask them to lift, and they're bumping up against me and they're like, oh, well, I guess I'm moving. So if you want to, go find a wall or shelf and go directly against it, and then you can work on lifting that opposite leg, and you can feel whether or not you shift into the wall or you stay away from it when you lift. So this is a great check for that exercise. Now, the other thing is to pay attention the entire time with your head positioning. Okay, so make sure your head doesn't drop down, and make sure you're not looking up. So head up in line with your body, weight shifted over your fingers, corset in place, nice and tight. Okay, neutral spine. And then as you're able to lift, okay, nice and small, arm and leg, and then arm and leg together without shifting, work on lifting it all the way up. All right, because we want to get a good glute contraction, we want to get good extension, but what I don't want to see is you arching your back when you lift. Because remember how we talked about that puts more pressure on your facet joints? And you have to relax your spine. You have to relax your core that's supporting your spine. So if I'm here and I lift all the way up and I let my back arch, what's happening to my belly and my core? It's going out, right? So videotape yourself. If you're letting everything just collapse down when you lift up, all right, it's creating problems on your back. All right, so give that exercise a try. Start small, maybe a set of 5, each one. Leg lift, arm lift, opposite arm and leg lift together, all right? And then as you progress, obviously the standard is 3 sets of 10, will help you gain muscle, okay? So progress forward and make it more difficult. Now, if this bothers your wrist, you can simply take a small towel roll and place it under your wrist, or you can just grab the edge of your yoga mat and you can roll it up, okay, so towel roll, and you can place your fingers underneath it, all right? So see, I'm doing that. Sometimes that'll give you a little relief with your wrist. Or grab some free weights, and you can turn the free weights where they're sideways, and you can hold on the handles just like you would pick them up to do curls, you know? And then you can hold like this, and that will completely take your wrist out of it. All right, so this is one of my favorite exercises for building core stability, getting you strong, and I want you to master this. All right, and then we're gonna move on and make it more challenging. I can't wait. All right.